Welcome to the Learning Lab. My name is Roman Garcia. I'm a physical therapist, and this will be volume 3 of a continuing educational series. Today, I will be demonstrating what a normal biomechanical marker for the knees are. But I will be showing you using some items to demonstrate what the physical properties of a normal knee versus an unhealthy knees are. And I'll be able to illustrate this very simply by the usage of simple objects that you've probably seen many times laying around the house. Let me show you what I mean. A healthy joint will have what I characterize as pliability, similar to a ball. For example, a healthy joint will demonstrate these types of physical properties. Pliability. Pliability in essence is this. Observe this ball. A healthy joint will have pliability. It will bounce when it gets exposed to a mechanical load, versus an unhealthy joint, which will demonstrate these types of physical properties. Observe this. There is no pliability. What's happening right here is this object is absorbing all the energy from the impact. It's not dissipating anything out into the environment. So you get that blunt force impact, versus a healthy joint with pliability within its physical makeup, such as this ball. Obviously, this is inanimate. A tissue is animate, but it demonstrates the same properties. This is a normal joint, healthy weight-bearing joint. This is an unhealthy weight-bearing joint whenever it gets exposed to a weight-bearing load. There's no bounce in it. It absorbs all the energy. All the energy stays inside the tissues. Now, what I want to do is I want to bring in my friend Anna, so I can demonstrate what the biomechanical properties or biomechanical markers of a healthy knee joints are. Anna, if you can please come in here. You're going to sit right over here. Now, the examination should always start with the patient sitting. The first thing needs to be done when you're examining a knee is to just palpate the joint space width, the joint line in essence. This is not something that can be taught in a weekend course. This is something that's learned. The more you do, you'll get a feel of what the spherical contour of a healthy knee joint are versus one that is not healthy. This takes a lot of practice. Now, all you have to do to help you gain this sensibility is just to understand one thing. A degenerative joint represents a hypertrophic condition. A degenerative joint will actually hypertrophy. So once you start doing this a few thousand times, you'll be able to palpate that hypertrophy. You palpate the medial joint line, you palpate the lateral joint line. As you can see, the fingers move in symmetry. Again, what you're trying to sense is hypertrophy. This is the first phase of the examination, hypertrophy. You're trying to detect hypertrophy. It's a very distinct sensation. It's hard to describe, you have to feel it. But in your mind, you're trying to palpate hypertrophy. And it is very palpable. It has a very distinct characteristic, sensory characteristics. These joint lines palpate relatively normal. Now, the next phase is to have the patient lay down completely flat. Now, Anna, if you would just lay down flat, your head right over here. In essence, this is the biomechanical marker. A healthy, pliable knee joint will have joint play at the terminal extremes. Again, this is not so much sensory as it is exposing the joint to a particular movement and then distinguishing the extension. This is the biomechanical marker right here. You ask the patient very simply, you put your hand underneath the knee, and what you ask the patient to do is to push straight down against your hand. She pushes straight down. Now what you're sensing for is pressure underneath your hand. What you want is symmetry. Symmetry between the right and the left. Alrighty, you ask the patient to relax, you come to the right knee. Again, you have the patient push straight down. She pushes straight down. Again, you're sensing, you're trying to sense for symmetry between the right and the left. Normally when a patient comes to the clinic, they'll either have issues on one knee or both knees. It really doesn't matter if the person doesn't have, or the patient doesn't have normal knee extensions on both knees, because we all know that a normal knee joint biomechanically will have terminal knee extension. Is those last 2 or 3 degrees. That is the biomechanical marker that you're trying to detect. Now after you expose the knees, push straight down. You're fine. Push straight down like that. Perfect. Do it with both knees, straight down. Alrighty, I'm detecting symmetry of knee extension on both knees. I know that both knees biomechanically are symmetrical. So what I am exposed to here right now is knees that the extension is normal actively. This is active. A degenerative joint, one that does not have pliability, will not exhibit terminal knee extension, and you can palpate it by the pressure that the popliteal space has against your hand as the patient is pushing down. Now that's the active biomechanical marker. Now the passive biomechanical marker is just that, it's just passive. You put your hand, your fingers right on the joint line. On the medial joint line it's more accurate than trying to detect on the lateral. You got a larger joint surface area on the medial. So you put your fingers right over the joint line, and then very simply, you just extend the knee very gently. What you're trying to detect is this joint plate. Again, you're trying to detect for symmetry. Symmetry means both knees have normal pliability. Obviously, Anna has healthy knees, so she's going to demonstrate symmetry. Again, you're detecting for this joint line. This is the passive biomechanical marker. And then the active biomechanical marker is with the patient pushing straight down against your hand. Again, a degenerative joint will not demonstrate these terminal knee extensions. Those are the biomechanical markers. That will give you an idea of what type of hard tissue or joint tissue you are being exposed to. It's a very important part of the evaluation process, because so much it is dependent on how much pliability these joints have insofar as the type of exercise you do with the patient. So unless you're able to gauge the pliability in these joints, then your treatment protocol may be more damaging than beneficial. Now let me show you what an x-ray will look like on a healthy knee versus an unhealthy knee. Again, we're looking after this pliability. On an x-ray, pliability is very distinct. Let me give you an example. This is the right knee, this is the left knee. A joint that's lacking pliability will demonstrate a very white appearance on the x-ray. Obviously, this is very obvious. You've got a right knee, left knee. Right knee seems a lot more degenerative than the left knee. Look how white it is, very white. This means this joint lacks pliability. There's no pliability in this tissue. All the biomechanical markers would be positive for the right knee. It would not be positive for the left knee. You will have that joint play at the terminal knee extension. Look at the difference. Look at this. It's kind of, you can almost see right through this joint. It's a little bit white, but not as much as the right one. This left knee is much healthier than the right one. Another way to put it, this left knee has much more pliability than the right knee does. Now, another important distinguishing mark, which I'll show you in a little while with some normal knees, is that look at the growth plate. On this left knee, you can still distinguish the growth plate. That means there's pliability in this joint still. This growth plate is still observable. Now observe the right knee. The growth plate is non-existent. The whole tibial plateau has mineralized. Now let me show you a normal knee, and you'll see the difference. Again, right knee, left knee. Look how transparent this joint tissue is. Look at the growth plate right here. You can see the growth plate. This tibial plateau has not mineralized. has not ossified. There's no ossification here. That means that there's a lot of pliability. These joints, if you were to use those biomechanical markers, would be negative. These would have normal biomechanical markers versus this knee. This knee will demonstrate an extension lag. All biomechanical markers would be positive on the right. On the left, not so much so. It's much more pliable. You can see the growth plate. There's pliability in this left knee. This knee is completely sclerotic. Very little pliability, if at all. Positive on the biomechanical markers, negative on the left. Now, this is the interesting thing. When you're doing a physical examination, it's important to understand or to have a conception of the joint space width. It gives you an idea how healthy that joint is. It also gives you some kind of guidance to what kind of exercises you can have that person do. The first thing that needs to be surmised is the pliability. How much pliability is inside that joint, and these biomechanical markers are very sensitive for that pliability. As we proceed with these educational series, I will be continuing to emphasize these biomechanical markers. Again, every joint in the human body has them, and in essence, all the biomechanical markers tell you is how healthy the joint is. From there, you can plan your treatment program accordingly. Some patients you can be more aggressive with, others you may not want to be that aggressive with because there's no pliability in the tissues. This is volume 3. For anybody that's seeing this video, I hope this gives you a little bit of insight into the biology of the tissues that we work with every single day of our careers. Hope to see you in the future, and you have a great day. Thank you.